Fox 40 News in the morning starts now.
There's lots going on in the world right now that can trigger anxiety. After the break, a health expert shares her guide to help cope with stressors. We are living in a stressful climate and it can trigger anxiety. Here to help us manage our mental health is Dr. Usha Mantha. Thank you so much for being with us today and talking through what a lot of people are dealing with right now. So first, I just want to ask you, what are some signs of anxiety?
So the anxiety, thank you for taking me today. So anxiety can be a chronic symptom, and some of the symptoms one should watch out for is constant state of irritability or agitation, being on the edge. It could be causing doom and gloom all the time, fear, and it could be one can have poor concentration and also nervousness, agitation, and importantly, one can reach out excessively for alcohol, smoking, and recreational drug use can slowly increase. However, these are the symptoms that can be gradually over a period of time, but acutely it can cause headache, dizziness, ringing in ear, chest pain, shortness of breath, palpitations. So these are the acute symptoms when your body is actually showing the symptoms of anxiety.
How hard is it to really notice or self-diagnose yourself with anxiety? Or, I mean, what are some things we should watch for that can trigger it?
So yes, with the new pandemic, the new triggers are actually something the lockdown related risk things that are happening with interpersonal relationships. How do you create space with social distancing at home? Second one is the financial burden, which has dramatically increased with loss of jobs and loss of wages, and that's actually number one cause for anxiety. So watch out for those things happening. Third one is technology, whether we are working from home or homework or filling forms or even the medical visits online is causing quite a bit of anxiety. So first of all, you should acknowledge that these are happening, and this will help us to diagnose ourselves that we are suffering from anxiety. So of course, when the anxiety has somatic symptoms, like I mentioned before, of headache and dizziness, and you're getting more symptoms, then it's time to ask for help.
What can we do to help manage our anxiety?
So there are 5 simple steps. First of all, acknowledge one has anxiety. Like there is a chronic phase of anxiety when you're reaching out for more help slowly. And one of the significant one is reaching for alcohol, smoking, and recreational drug use. If that is going high to calm your nerves, as they say, then it's time to look into that you have it. So first is acknowledge that you have anxiety. Second will be ask for help. Call a friend, a family, your doctor, or your therapist. Second is there are some self-help apps available, and the two actually endorsed by American Academy of Family Physicians is called 7 Cups, and second one is Fear Tools, and they are actually available on your cell phone, so it's a good idea to connect with them. Third is to distract with doing your music, your exercise, yoga. Transcendental meditation has definitely shown that it actually relieves anxiety. So, of course, all of these fail, then you have to go for therapy. And one of the very proven therapy is called cognitive behavioral therapy. It is basically about if the reaction that we have towards the stress, the anxiety, is about the stress itself and not so much about us. So we have to learn a learned behavior.
Perfect. Thank you so much, Dr. Mantha, for taking the time to talk to us about anxiety today. We really appreciate it.